All right, hi everyone. My name is Decker. We're just going to be going over bulk flow in the capillary. There are two main pressures that contribute to bulk flow. We have hydrostatic pressure, which is the blood pressure, and colloid osmotic pressure. The variable pi for colloid osmotic, it is not the same as the ratio of circumference to diameter. It's not 3.14. I've been asked that question enough times that I feel like I should say it in the video. It's just the variable. The Greeks gave us 24 letters, and we've used every one 100 times. As you get to higher level bioclasses and Wikipedia, you will occasionally see colloid osmotic pressure referred to as oncotic pressure. They are the same thing. If I slip up, they're interchangeable. So first for hydrostatic pressure, P subscript H. Like I said, it's the blood pressure. It's the force the blood exerts onto the blood vessel. It's pushing outward onto the vessel. It's directly related to blood pressure. As we get further away from the heart, blood pressure decreases, which is the same for hydrostatic pressure. And then the other force that's contributing, colloid osmotic pressure, it's the force of water movement into the vessel. Because there is a higher protein concentration in plasma compared to the interstitial fluid around the vessel, water is going to be drawn from the area of low concentration to higher concentration. In this case, water from the outside is going to be absorbed into the vessel from low to high. This is the example of the capillary from lecture. It is my favorite diagram from 203. We're going to be watching blood flow from arterial to venous along this arrow. First, we're going to look at hydrostatic pressure. It's going to go from 32 torr to 15. As we get further away from the heart, we're decreasing in blood pressure, decreasing in hydrostatic pressure. Colloid osmotic pressure is going to remain the same, that red line. It's going to stay 25 torr since it's just the amount of protein in the blood. The relative size of hydrostatic pressure and oncotic pressure is going to decide if we're filtering fluid out of the capillary, out of the vessel into the interstitial fluid, or from the interstitial fluid back into the capillary. As hydrostatic pressure is higher than oncotic pressure, we'll have net filtration of fluid into the interstitial fluid. When we get further away from the heart, past the capillary, past the equilibrium point, still in the capillary, hydrostatic pressure will be less than colloid osmotic pressure, and we'll have net absorption of fluid from the interstitial fluid into the capillary. These are just some generalized statements that it's useful to have, if not memorized, written down. Net filtration occurs over a longer length of the capillary compared to absorption. So just using these should help you on any question that might come up. It's not too hard of a subject. Yeah, using these, good luck on whichever exam is next.